to the big question. What is the tipping point for you in your vote?
Well, I'm going to vote for the bill. I don't know why you said I'm still on the fence. I'm going to vote for the bill. There are a lot of problems I have with the bill, primarily that it doesn't go too far enough. I really wish we'd had the public option in this bill. There are some other problems with it, but bottom line, the Harvard Medical School study tells us that 45,000 Americans per year die for lack of access to health insurance. A no vote on this bill is a vote to kill 45,000 Americans a year. A yes vote is a vote to save their lives. Everything else is secondary.
When did you make your decision, sir?
Oh, probably a couple of weeks ago, I imagine. I mean, we were pushing very hard for the public option and for a number of other things in the bill, and I certainly don't like the excise tax. We're pushing very hard to push that out, but the president unfortunately insisted on it. I think that's a major mistake, but we'll try to get rid of it between now and 2018 when it goes into effect. But bottom line, this bill is a major victory for the American people. It gives insurance to people to 30 million Americans who don't have it, and it ensures that people who have health insurance don't lose their insurance when they get sick. It ensures that if you get really sick, you're not going to go bankrupt because the co-pays are too big. 55% of all personal bankruptcies in this country are because of medical emergencies, and 75% of the people who go bankrupt because of that have health insurance that isn't adequate to the problem. This ensures that no matter what happens, nobody will ever have to pay more than $10,000 a year for a family out of pocket under any circumstances.
So for those 10, depending on how the counts are coming, and so the Democrats that really have yet to put their vote out there, what is it that is keeping them from putting that vote out there? Is it a look at their political districts, wondering about the political wins, wondering about their job security, depending on how they vote?
Well,
or is it moral, ethical, financial?
I can't go into the motives of other people, but obviously there's a lot of pressure being put on people. There's a lot of misinformation about the bill out there. The amount of lies and disinformation is incredible. Some people may not be clear yet, although I think the CBO, the Congressional Budget Office score from yesterday should clear this up, and that is the allegation that this would worsen the country's deficit, which is a serious problem. The fact is, the neutral, nonpartisan Congressional Budget Office has said that this will reduce the deficit, reduce it by $138 billion over the first 10 years and by $1.2 trillion over the next 10 years. So if you're concerned about the deficit, as hopefully most people are, if you're concerned about the economy, if you're concerned about saving people's lives, if you're concerned about middle-class people not going bankrupt because they get some very expensive disease, you have to vote for this bill.
Okay. Congressman Jerrold Nadler with a yes vote in the bag. Thank you very much, Congressman.
You're quite welcome.